plus if she doesn't mute her laptop's mic, that's what happens.
Yeah, I think we were talking about that
The time
last
before.
time we were doing that.
Yeah.
It causes a little bit of an issue with because the board actually has a mic on it. So when you turn down the connection, the USB connection, it actually lowers that mic.
I was wondering what that was.
Yeah.
So annoying.
Yep. And it's difficult because um, usually if you just mute it, it's fine, and it doesn't make a problem. But um, if you, the person's um, mic on their laptop is still on, it'll give that echo. So
Right.
it's just gonna be us today because we have no Thelma and we have no Raylene, and um, Ladon is out of town, and so it's just going to be a quick and easy update for the community. We're going to see if anybody wants to join us first before we go. There's one person. Welcome. I'm going to get our little soundboard going. And there it is. I know when Lillian gets on, she always says that sound is irritating. So I want to try to keep it as low as I can, so it's not too bad.
Sorry.
Okay, well, we're a little late, but good morning, everybody. Thank you for logging on, for those who are online watching for our weekly update for COVID-19 and the Health and Human Services Department. It's me, Troy, and Rebecca, and Claudia, and we have Darylyn in the background there as a new member of the team. And so I wanted to start with that introduction, I guess, Darylyn, if you're ready to say who you are and what your position is with the department. Darylyn started with us on the 31st, 2 days ago. So if you wanted to say your name and what your position you're in, and then we can kind of talk a little bit about what your role is going to be as part of the team.
Hi, I'm Darylyn Martinez. I've been on as the community health worker for COVID-19.
And just wanted to make sure everyone gives a good welcome to Darylyn, her job. So throughout the pandemic, the Health and Human Services Department, specifically the CHRs and the diabetes prevention specialists, Claudia, Thelma, and Raylene, have been the primaries handling COVID-19 related duties, whether it's the on-call, contact tracing, testing, getting people set and scheduled for vaccinations, things like that. And so their jobs and the duties that they're supposed to be engaging in kind of suffered because they were so involved in doing a lot of the COVID-19 specific activities. And as we are working to come out of and rebuild after COVID, there were opportunities that we were provided to add resources, including people, staff, to help to rebuild, provide community education, doing community outreach, as well as be part of the efforts to keep the community safe from COVID. And so the funding came around to allow us to add a community health worker that's specific to COVID-19 to kind of take on some of the tasks and duties that the other team members were engaging in and not able to do their regular work. And that's where Darylyn's position came from. So Darylyn will be part of the COVID response team. She'll be doing some of the same exact activities that the rest of the team have been doing, but adding on the community education and community outreach component to kind of keep people aware of the things that are going on surrounding COVID and people recovering from COVID and the community coming out and rebuilding from COVID. We haven't really discussed that in detail, she and I, to kind of give a really good understanding of what that consists of. But that's basically where her addition comes in. Take some of the strain off of the rest of the team and allow her to take over some of those activities is what's going to be part of her job. Hence the name Community Health, keeping the community healthy, and reaching out to folks in the community that need that extra support. So that's what Darylyn is here for, and I want to just give people an opportunity to welcome her to the team, and then we'll get started with the update. So if any of you have heard the blast yesterday about COVID-19 and what the current status of the community is, you will know that there is a spike of cases and hospitalizations across the state, really across the country. But I think that the state of New Mexico was kind of spared a little bit for a while, where they weren't being hit by the number of cases and the number of hospitalizations like the rest of the country has, and now it's happening. And so the state of New Mexico is experiencing a pretty significant spike in both areas, hospitalizations and the number of positive cases. I think the Santa Fe service unit positivity rate went from single digits, I think it was like 6% or 5% of the cases that were coming through were positive, to last week it came out to is now at 19% of all cases. So 1 out of every 5 tests that's taken in the Santa Fe service unit for the Indian Health Services is positive. And what does that mean? That means that we are going to have to probably expect individuals who are in the Indian Health Services service provider area to start having a lot more positive tests. I think Milwaukee and some of the other surrounding communities have had some outbreaks, and now we have a few cases that did not exist last week or for a long time, and so it's starting to creep into the community as well, because it is to be expected. And one of the other things that we need to understand is that more than 30% of the positives in the Santa Fe service unit, positive cases for COVID, were vaccinated individuals. The new Omicron subvariant, BA2.12.2. I know people are tired of hearing all those numbers, but it is causing quite a bit of infection across the country. In fact, it's one of the most contagious and most transmissible variants of all the variants since the pandemic started. So looking at that, and looking at there are quite a few breakthrough cases that are coming along, we need to start pushing the safety precautions again, around social distancing and masking potentially, to make sure we keep people safe while this spike is happening. There are individuals in this community who have received their vaccination series, their original series, plus their booster shot. But their booster shot was more than 6 months ago. And as we've talked about on these live streams throughout the pandemic over the last several months, um, the protection that the vaccines are providing they wane somewhere between 4 and 6 months after receiving that vaccination. So 2 weeks after you get your booster, you're at the greatest protection level, and then it starts to wane after time, just like the flu vaccine and some of these other seasonal vaccines that require you to get an annual dose. It starts to wane after a period of time. And unfortunately, the mRNA vaccinations are waning in protection somewhere between 4 and 6 months after that shot. And we talked about this before. People were saying, "Well, why even get the vaccine?" Well, unlike the flu, where the flu is really seasonal. It comes around in the fall and the winter and early spring, and then it kind of disappears. And so, thinking about that, in comparison to COVID hasn't really gone anywhere. It's just been sitting around. If we were monitoring the flu like we do COVID all these years, we would know that the waning of protection of the flu shot is similar. It's almost exactly the same. But since we aren't monitoring it every day, we're not getting reports about it from the CDC and Johns Hopkins University and all these different places that are monitoring vaccinations and protection levels of the vaccines. We aren't doing that for the flu. Haven't been doing that for the flu, so we didn't know anything about it. It was just in the back of somewhere out there in space where it was happening, but nobody was talking about it because nobody was monitoring it. The COVID, since it's the new thing, the big thing, it's talked about every single day. It's being researched and looked at all the time. We are monitoring that, so it's no different than the flu shot. It's no different from the protections that the flu vaccine increases and wanes throughout the season. And so we need to look at it from that perspective and not look at it as, why are we still getting all these vaccines and why do we need all these boosters and things like that. It's similar to that same process with the flu shot. So I think we all hate the fact that that's the case. We wish that COVID would just disappear, but it's not. It's still hanging around, and the more bodies and more hosts that it has to occupy, the longer it's going to stay around, which is the reason why we push vaccinations and social distancing and wearing masks and using good hand and cleaning hygiene to kind of keep the virus from spreading. So with that being said, we now currently have 3 active cases in the community. We were hoping that we would have gotten the one case that came along would have just been the one isolated case, but it seems like based on the circumstances around how this is being spread, there may be some more cases coming up in the near future, especially after the Memorial Day weekend and gatherings and things like that, knowing that the virus has been kind of lingering in certain members of the community. So there's a possibility that it might start spreading again. So just keep that in mind as we continue on over the next several weeks. The spike is supposed to go on from this point all the way through towards the middle, maybe the end of summer, potentially. And hopefully that's not the case, but that's what they're predicting. And that's really the basics of the update for this week around COVID. Now, as a reminder, those of you who are immunocompromised, whether it's moderately mild, you have a mild or moderate immunocompromised medical condition, there are medications out there if you do test positive, but just have to remember that you have to go see your primary physician within 5 days of exhibiting symptoms. If you have mild to moderate symptoms, you can actually get medication. It's a 5-course series of pills. It's called Paxlovid. For those individuals who might be interested in getting that, if you do test positive and have mild symptoms and you have a specific medical condition that puts you at higher risk of serious illness, contact your doctor within 5 days. Don't wait. Because after that 5 days is up, you're no longer eligible to take that medication to help reduce the viral load, is what it's supposed to do, so that it doesn't overwhelm your system and make you too sick or put you at risk of being hospitalized. So I'll let Rebecca take over some and add her comments, because I know she has some.
I always have something to say. Yeah, so, we're still in a pandemic. I know a lot has changed, and it doesn't necessarily always seem that way, but we really want to remember that it's still out there. Our state numbers, as far as the state of New Mexico goes, they are slowly creeping up. They look a little different than the last surge, which is encouraging. It means that, even though there are going to be breakthrough cases, people are still going to get COVID after vaccination, and even possibly, weeks or months after being boosted. It's looking better in the respect of whether or not you need hospitalization and whether or not you need ventilation. I really want to take a moment to emphasize how challenging it is for the human body to accept artificial life support, and how hard it is for folks to rehabilitate after having the need to be ventilated from COVID-19. Also, even being hospitalized, sometimes, there have been a lot of things that have happened over these past 2 years in the hospital settings, and things have changed. Hospitals' abilities to provide staffing sufficient to, maintain not only health, but also comfort can be a challenge. So you really want to do everything that you can to stay away from our hospitals, especially while we're experiencing a slight increase. More and more people are going to need healthcare services in the inpatient setting. So just want to keep those things in mind. It's still can be a very dangerous virus. We're probably we're not at capacity in the state for hospitalizations. We, as far as I know, as of today, we have 130 folks that are hospitalized. Out of those 130 people, there are, I believe, 18 folks who have required ventilation. We are a large state with not an enormous population, and we're somewhat spread out. So these things we can use to our advantage in our environment, that we can help, keep these numbers low, keep each other safe by hand washing, wiping down surfaces in your homes. If there are things that maybe somebody who's got a cold and sneeze all over a box of tissues, go ahead and get rid of those. We want to keep clutter down, and keep our surfaces clean, and mask up when you're going into, if you have to go to the supermarket, or if you need to go to the convenience store, or anywhere where there's a lot of people indoors. It is your choice. At this point, there is no state mandate. As far as here goes, I know that are we still at, which step are we at, Troy?
We're still
right now.
We were fully open still.
Yes, so we're still fully open. But it's your practice of health when you choose to wear a mask. Don't let folks, if you feel like people are looking at you funny, just remember that the virus doesn't discriminate. It makes everyone sick. So wear your masks when possible. When you feel like that it'd be a good opportunity to wear them. We have masks. If you still need some, we're happy to provide those for you. We have tests and we are still testing. So when you need that, even if you're just, maybe you've got some kind of allergies or just the common cold, you're not sure, come down and get tested. We'll take care of that. We're here to support you. This virus isn't going away, and neither is the team. So just want to encourage everyone to just keep that in mind, that it's still going around.
Thank you for that, Rebecca. I wanted to add to that. In conversations with some of the folks around in the medical community and the local hospitals, there were comments. I had a conversation with someone yesterday, and I was told that the local hospitals, Presbyterian Hospital and even Los Alamos, has had a significant increase in the walk-ins in the emergency room for COVID-19. So just to give you a comparison, I guess, over the last, several weeks, they were averaging maybe 6 people walking into the ER that were either complained of COVID-like symptoms or testing positive for COVID. And I guess over the past 2 weeks, they're experiencing like 100 walk-ins a day. Now, our numbers in the state are always going to be behind, because it's going to be based on tests that were taken and reported to the Department of Health, and indicating what our current case count is in the community, and understanding that it's behind these numbers that we're talking about these 100 people walking in. Those may not reflect what the numbers show today. So don't be surprised if we get this really significant increase of positive COVID cases over the next couple of weeks, showing for the state numbers, because there are quite a few people that are now showing up in the ER that have tested positive for COVID-19. Now, mind you, we are having a really huge surge of influenza A, as well as certain colds and other respiratory illnesses across the state. But the COVID-19 numbers are what people are probably most interested in, right? Not that you can't get really sick and die from the flu, because you can. And not that you can't get really sick and die from RSV, because you can. So, but we just need to make sure we're understanding that the focus in our society right now is on COVID-19 and the number of cases, the number of people that are getting sick, and other people that are dying of the virus. When you hear these really significant increases in numbers for COVID-19, we need to start paying attention to that and start looking at that as a warning sign that maybe, just maybe, we need to start taking extra precautions again and trying to keep our community safe. Because, the Omicron subvariants are a lot less severe in many cases for some people, but that doesn't mean it's like that for those people who are vulnerable, those people who are at risk. So keeping the community safe, those individuals who may be at high risk, those people that are over the age of 65, those people who have specific medical conditions, those are the ones that we need to be safe for. If you're not really concerned about getting really sick, you either had COVID before and you feel like it's not that big of a deal if you get it again because it didn't do much to you, just think about it. Whether you're symptomatic or not, you're able to spread this virus to other people. Those other people might be those individuals who are at high risk, or might get a little sicker than you did, might end up in the hospital, might require, ventilation, going on a ventilator. That's what we want to try to prevent. So we're not trying to catastrophize and saying, oh my gosh, this is like the beginning of the pandemic again and everybody's going to get sick and die. That's not what we're saying. We're saying that we need to be paying attention to who are most vulnerable in the community. Those people who might get exposed or infected with the virus that may have a harder time than either you or the folks that who have had COVID. So taking those precautions, like what Rebecca was talking about earlier, what we mentioned earlier, are extremely important. We need to make sure that we do what we can to keep the community safe. Again, we have test kits here that we can hand out. If you have, or you're out, or you haven't utilized the online order to get more home test kits, we have some. And we need to start giving them out because we can't keep them forever. They will expire. So if you need home test kits, contact us. We'll get you some. If you need to be tested because you've been exposed, or you have symptoms that you think might be COVID related and you don't know if you've been exposed, call us and let us know, and we can get you a test. And if you test positive, we can get you connected to the services that you need, whether they are connection to a medical provider, or isolation at Buffalo Thunder, or something to help you to get past the scary time of either being infected or wondering if you're infected with the COVID-19 virus. So Lenore.
I'm sorry, go ahead.
Go ahead. I just say Lenore's on.
Oh, great. I have to say, it was for the past year and a half, 2 years, it's been kind of nice not getting, the flu in the winter, or worrying about kiddos getting, children getting RSV or whooping cough, things like that. The masks have actually, in that aspect, have definitely been very helpful against other infectious communicable diseases, especially for children and elderly, and the immunocompromised. So, that's been sort of a boost for I know for myself. I don't know for everyone else, but those things sometimes they go on year round at really low levels, and so they'll only affect people who do have the immunocompromised status, or who are specifically young or older. The other things that I just wanted to briefly mention are, people may have been hearing some news about monkeypox. There are currently 2 cases in Colorado. It is mostly very identifiable. So if there was a situation with that, it would likely be caught pretty quickly. But I just wanted to ease people's feelings about that. And also, if you have any of the peanut butter, any of the Jif peanut butter products that I mentioned, you can go to the FDA website. They have photos and an explanation of the lot number on the containers, and this includes all varieties of Jif, that they had a salmonella outbreak. We want to keep you safe and not let you have food that might make you sick. So go ahead to the FDA.gov website and check out those lot numbers. And if you have one that fits that description, you can simply make it, throw it away, but also you make it inedible for critters and people who might access that through the garbage, so they don't get sick too. And that's all. I just wanted to add those things.
Yeah, the monkeypox thing has been talked about a lot. It is a lesser known relative of the smallpox virus. And so, in large part, there's a vaccination that can help prevent it. It has not been used in years because there hasn't been a reason to use it. But if there ends up being a significant outbreak, I'm sure the federal government did announce that they were going to break out their supply of vaccinations in case they need to start using it. So just so you all know, there is a preventative measure that the federal government has to help to prevent the monkeypox if it does become a thing. So just wanted to throw that out there. Does any member of the team have anything else they want to add to this conversation before we move on to the Health and Human Services update?
I do. Can you hear me?
Yes.
Okay. I just wanted to let everybody know that the Walk for Wellness on Tuesdays and Thursday mornings are now at 8:15. So come out and come join us whenever you guys get a chance. And remember, at 8:15. That's it.
Tuesday and Thursday. Thanks, Victoria.
Where's my thing?
You're off to the side there, Claudia.
I'm trying to find where the camera is. I just wanted to inform the community that I got an email from DOH, the New Mexico Farmers Market Program, so that they've extended the for individuals to still apply for the farmers market cards. So till further notice. So if anybody's interested, give me a call, and I'll follow up with the other individuals that haven't turned them in. But we've got, I think I send in like 30 applications for the 30 seniors in the Pueblo. So they should be receiving their cards next month in July. So I just wanted to inform the community on that. Thank you.
Thank you, Claudia. Anybody else have anything?
That's it. What did he say?
Oh, I just wonder if anybody else had anything.
Oh, sorry, can't hear.
All right. I just wanted to also take an opportunity to introduce our new ICWA manager. Are you on the camera there, Lenora? Or
Hello. No, I don't know how to get the camera on. Sorry.
well, you can go and jump into Victoria's office and take over her camera if you want.
I'll go say hello real quick then.
Real quick, I'm just going to throw a link up for the strawberries as well, just so people have that information. It's not as widespread, but I just wanted to put that out there, that the FDA was finding that some organic strawberries were giving some folks hepatitis symptoms. So
hepatitis A, to be exact. And so you all know there is a vaccine for that as well. So Lenora, would you like to introduce yourself?
Well, I'm Lenora Arieta, and I am here now with Legal Manager and Family Advocate. I'm glad to be back. And let's see. I grew up in Milwaukee, went to school in Milwaukee, but I live in Santa Clara, Pueblo now. I have one son, and that's about all I can come up with now.
So for those of you who might be wondering, I think we announced a couple of months ago that Pretty Water was leaving us, and she went down to part-time, 10 hours a week, until we hired a new person to replace her. And at this point, we've identified that person, which is Lenora. And so now she started on Tuesday, just like Darylyn did. And so she's getting her feet grounded again and putting herself back in the position she was in before, and getting and taking off running to provide the ICWA services and the family advocacy services that Pretty Water was providing before, as well as some additional program services that we are going to be adding in the near future. So I'd like to thank Lenora for choosing to come back to us, and we're going to take care of some things. So one of the things that she and I talked about, making sure we try to expand, is the behavioral health services for the young people, especially in the community, and foster care, licensing, education and training, things like that. So circle of security, parenting classes, all those things that we have needed to get started. And so we'll be announcing some new things here soon. But in the meantime, just say welcome. Jeannie says welcome, Laura, in the chat. Me Gonzalez.
Well, thank you. I'm glad to be back.
All right. So anything else? It's 12:04. Anything? Oh, So on June 7th, we are going to be having our next iteration of the Community Health Assessment Survey collection in person. It'll be here again at the Senior Center. Be serving dinner. It's scheduled from 4 o'clock to 6 o'clock. If you got your bulletin, you'll see that the flyer is in there. It also should be hanging around with the cluster boxes. You can see that there. But if you have not yet done your community health assessment, you live in the Pueblo and you are an enrolled member, you are welcome to join us on June 7th at the Senior Center, 4 to 6, to come in and complete your survey. In response to you completing your survey, you will get a $50 gift card as an incentive and a thank you for helping us to try to improve the services that we provide for the community. In addition to that, what day is our men's health?
It's on June 22nd at 5:30 p.m. at the Senior Center.
So in honor of June is Men's Health Awareness Month, National Men's Health Awareness Month. Similar to what we did last month for Women's Health Awareness Month, we're going to be providing a men's health event at the Senior Center, 5:30. June, what was it again? I should type that out. So
June 22nd.
June 22nd.
At 5:30 p.m. at the Senior Center?
Perfect. So if you are a community member, age 12 and older, and you are a male, you can participate in this program. We will provide you food to eat. And I personally will be, just like I did with the Women's Health Month, providing a mental health awareness presentation to talk about the challenges regarding mental health, especially in Sani community, especially involving men. So I look forward to seeing you all out there, and hopefully we'll get a good turnout similar to what we got for for Women's Health in March, whatever month that was. Last month. You know, it all runs together. It gets all confusing sometimes. So join us on that day. And May 31st was the last day for the community to turn in their proof of third vaccination for the $60 gift card. So that has expired. However, we may plan to expand that to the 5 to 11 population who just authorized their first booster last month. So keep an ear out for that too. There are members of the community that are 5 to 11 that did not get vaccinated in their primary series. So that's still available as well. But if they get their booster shots, we will put out a notice to talk about what the incentive would be for that as well, especially since there is an increase in infection rate amongst the younger population from COVID with this new subvariant of Omicron. So that includes young people being hospitalized. So we want to make sure that we get our young people protected and vaccinated if they are eligible. So contact the COVID response team, 505-252-5986 if you have any questions about the vaccinations for the 5 to 11 population, or any vaccination questions you might have, as well as getting tested and test kits, and just simple questions you might have. So that's all I have. Any member of the team have anything else that they want to add before we take off?
Troy, I just wanted to invite the community and inform them of blood pressure screenings that we have at the governor's office, the conference room, on the 1st and 3rd Wednesday of each month. You're welcome to come. We're there from 8:30 to 9:30. We do your blood pressure, your glucose checks. We do your POTS, your oxygen. and all that. So I just wanted to extend an invitation to the community. If you're interested, come see us on the first Wednesday and the third Wednesday of each month. Thank you.
Claudia, I'm going to put that in the chat box as well. First and third Wednesday of the month at the governor's office in the council meeting room. And there it is. Anything else? Anything from Healthy Kids? You want to talk about the garden kits, or you want to save that for another time? I know that we were supposed to have a guest here soon, but
we do have some extra garden kits if anybody's interested. Either call us or text, whatever. It comes with a bag of soil, what is it? Different seeds, and what is it? The tubing for the water. So if you're interested, let us know.
thanks, Victoria. Also, for last thing, if you have a gym membership through our fitness program, if you recall, when you signed up, there was a requirement listed that you are to complete a fitness survey at the end of every single month in order to be able to continue in the program. And so the survey is now posted, and we wanted to put it in the link. It will also end up being on the HHS website here soon. You can complete it. It is a quick survey that's asking about your progress in your fitness journey, whether it's your nutrition or your activity level, any challenges you might have had over the last month. We'll fill that out, and you need to complete it with your participant identification number. And if you don't have that, you will need to contact one of us in the diabetes program, or contact Victoria for the Healthy Kids program to get that number, because you'll need to put that number in when you complete the survey. You'll see when you click on the link where it goes. It's the first question, actually. In fact, if you don't complete it, you won't be able to move on through the survey. So I'm going to go ahead and put that in the link, or in the chat box. So click on that survey. It's a SurveyMonkey survey. Click on that link and complete your survey. That way, at the end of the quarter, when we look at the numbers and the participation information, that your survey is completed and that you'll be able to continue in the fitness program with your membership moving forward. So that's all I have. Anybody else? Well, it's 12:13. It's way into the lunch hour. We probably should have ended this a while ago, but we started late. So again, from the Department of Health and Human Services, the COVID response team, I'd like to thank everybody who joined us and listened live. And also wanted to thank you for listening or rewatching this later on if you choose to watch it after the fact. And as always, the comment section is always available. You can put a question or comment in the comment box at any time, whether it's today or later on. We're always monitoring it. And if you have a question or comment, we will get back to you if it requires that, or if you're requesting that. If you need something that's a little more, need a question answered that's a little more urgent, that you can't wait for us to get back to you from the comment, you can always call or text the COVID hotline, 505-252-5986, or you can email us at covid@sanipueblo.org, and we can get the answers to you there. But on behalf of our team and our department, thank you all, and we will see you next week. Have a good day.